Today's topic is isolation policy. Those who have the textbook, please mention the chapter number in the page number in the chat box. Those who have the textbook. So MRSA and VRE. These are one of the infections caused by antimicrobial drug resistant microorganisms. Okay, it is resistant. This MRSA and VRE, these infections are resistant to several antibiotics. Okay, and it can anyone is susceptible for MRSA and VRE. Okay, any human being is susceptible towards MRSA and VRE. Okay? It's page number 59, those who have the textbook. And usually the risk increases for people who are hospitalized, okay, or even who are in nursing home kind of a stay for a long period, who regularly come in skin to skin contact with others, like contact sports, okay, unhygienic places, crowded places. Okay, so in all these situations, MRSA infections are very common. So, under the symptoms of MRSA, uh, there could be some redness, swollen area, painful. Okay, it is warm to touch. Which all area is infected with MRSA? The area that is infected with MRSA strain of bacteria, they are red, swollen, painful, warm to touch. That area becomes full of pus. Okay, there will be fever in this person. Just by looking at the skin, you will not know if it is MRSA infection. Okay, usually people confuse MRSA infection to a spider bite. Okay, because the area where this infectious bacteria is, it looks like a spider bite. It resembles a pimple or a spider bite. Okay, so people confuse it with that. So getting a blood test done is important when it comes to MRSA infections. And if at all you come in, it is diagnosed that somebody in your family or in your surrounding has MRSA infection, okay, immediately you have to contact your healthcare provider. And if the fever does not go down within 48 hours, immediately contact the healthcare provider, get into a hospital. Do not pick or pop the bump or sore. It looks like a pimple full of pus. If you feel like popping it, okay, don't do that. So you have to cover the area with clean, dry bandages until you see a healthcare provider because you don't want anyone else touching it and them also getting infected. Okay, and always clean your hands. Often clean your hands. Practice hand hygiene. Whoever is infected with MRSA. There are some complications of MRSA as well. If it is not treated at the right time, it can lead to pneumonia, lung infections, bloodstream infections, surgical site infection, sepsis. If it is untreated, not just this strain of bacteria, but various strain of bacteria can come and attack the person's body, leading to sepsis. Okay, and death also if it is still untreated. Who are the people who are at risk because of MRSA infection? Athletes, school students, daycare school students who are in contact with each other, military persons, if they are posted somewhere and they are together staying in a barrack, okay, like a bunk bed system. People who get medical care in a hospital, okay, patients who are in a hospital, all the inpatients, people who have some medical device inserted in them during the treatment uh, scene, okay, throughout the treatment scene when a medical device has been placed into them. Okay. So even in hospitals, if MRSA infections are not treated, it can travel across hospitals from one hospital to another hospital. That is how invasively MRSA infection can spread if it is not controlled. If the staff is not following proper hand hygiene techniques, okay, from one hospital to another hospital as well, it can spread through referral cases, okay. So in MRSA infections also, while for treating it, healthcare providers will give high-end antibiotics towards which the MRSA strain will not be resistant. Okay, high-end antibiotics has to be given. Frequently hand washing, hand hygiene, mm, following the contact transmission resistant personal protective equipments. Okay, through that MRSA infection can be controlled. Then we have VRE infection, vancomycin resistant enterococcus infection. So it can this VRE strain, the strain of bacteria, it can cause infection of your urinary tract, bloodstream, wound, okay, which are associated with catheter, surgical procedure, okay. These are also bacteria which are resistant to antibiotic, specifically vancomycin. That's why the name is vancomycin resistant antibiotic infection. Okay. For the MRSA treatment, vancomycin can be used, but slowly in the 2000s, after the year 2000, VRE infections came into existence. Until 2000, vancomycin was the highest antibiotic which was used. Okay, but that also got abused. So we have a new strain of bacteria that are resistant towards vancomycin. Okay. So it's a pretty new infection, vancomycin resistant enterococcus infection. It came in the early 2000s. And enterococcus, it is a bacteria that usually lives in your intestine. Okay. And also, if you are a female in the female genital tract as well, this organism stays. It will not usually make you sick. Okay. But sometimes if it explores the other parts of your body, okay, like bloodstream, urinary tract, brain, heart, valves, then it is an issue. Okay, it should stay. Enterococcus should stay in the intestine. Enterococcus should just stay limited to the female genital tract, not more than that. But when it starts spreading, that is when it can make the person sick. So VRE infection usually affect people who are already sick and admitted into hospitals. And it is very hard to treat from a doctor's point of view, from a physician's point of view. VRE is generally hard to treat because most of the antibiotics, this strain of bacteria is resistant to most of the antibiotics. And it could be life threatening as well if not treated. Okay. The symptoms are fever. Generally, they feel sick, very weak. Their heart rate is very high. They have redness, swelling, and pain in the body wherever this strain has attacked. The person will have chills as well. Okay, they will shiver as well. People who are treated for a very long time with vancomycin have a risk of this infection. Okay, people who have serious kidney disease, blood disorders, they have spent a long time in hospital. Okay, and they were put on antibiotics throughout the entire time. People who have a very weak immune system, who just had surgery very close to their abdomen or chest area. Okay, so this intestinal bacteria can spread through that wound. Medical device that was put on the patient for a very long time. Females who were catheterized for a very long time. Okay, people who are 60 years or older and who are admitted in a hospital. So these are the cases who are at a high risk of developing VRA infection. Okay, and this is how it transmitted using contaminated equipment used on the colonized patient. If you use the same equipment on other patient, they get infected. Healthcare workers, if they don't wash their hands regularly and they go on treating other people, if they are spreading the infection. Okay, if other patients are also using the same bathroom, sinks, toilet, doorknobs as a person who is affected with VRE. Okay, so it's a contact based transmission. So the susceptible patient will also get sick. So the following procedure should be followed when it comes to isolation policy in any hospital. So first is isolate. Isolate the patient from all the other patients. Do not keep patients who suffer from MRSA, VRE, or any other transmission-enabled infections. Do not keep them in the same ward as other patients. So the first and the foremost step is isolate them. Then accommodate them in a separate room or accommodate them or cohort them. All the people, all the patients who are suffering from MRSA can be put in the same ward. Okay. All the people who are suffering from VRE can be put in the same ward. If you don't have enough isolation rooms, you can use this technique. People suffering from the same condition, same infection can be put in the same ward. So that's how you can accommodate or cohort people who suffer from same kind of infection. Okay. Hand hygiene by default has to be a very most important factor that can prevent the transmission of various infections. So staffs have to be very strict about hand washing. Not just the staff, even the visitors. Okay, people who come to visit MRSA and VRE patients, they also have to be very strict with their hand hygiene procedures. Then disinfection has to be done at least twice a day Wet mopping has to be done inside the isolation room by the housekeeping staff using proper disinfectants. Okay. And once the patient has left the ward, has been discharged, total disinfection of the entire room has to be done. Okay. Fogging fumigation can be done before you admit any other patient to that isolation. Then linen gowns, masks, gloves, all the PPE that is required to protect the staff, protect the other patient, and protect the patient themselves, okay, has to be used based on what kind of infectious transmission they have, what kind of mode of transmission they have. Then reusable dishes and utensils, stainless steel dishes and utensils can be used because once you wash after using these utensils, if the patient uses these utensils and they have been washed with soap and water, the utensils are good to go. It can be used again. Okay, soap and water will usually disinfect all the MRSA and VRE virus, that bacteria that would be on these utensils. Utensils. Okay, so you don't have to use disposable dishes, use and throw dishes. No need to use that. Use the proper stainless steel dishes and utensils for the patients. That's fine. But after the utensils have been used by the patient, it has to be cleaned with soap and water. Okay. Chlorhexidine gluconate bath and wipes or patches can be used. They are very effective in preventing drug resistant infection. Okay. Every isolation ward, every isolation room should have a stock of this chlorhexidine gluconate wipes. Okay. If you can't give bed bath to the patient, okay, wipe the patient's entire body using this chlorhexidine gluconate wipe. Okay. It is antiseptic in nature. Okay. It is good for them maintaining their personal hygiene and cleanliness. Okay, and also it takes care of the bacteria which may be on the surface for patient's body surface. Then terminal disinfection post discharge, after the patient has been discharged, complete disinfection of the bed, the bedside tables, cardiac table, pillows, mattress, floors, fumigation, fogging. This all comes under the complete disinfection, terminal disinfection after the patient has been discharged from the isolation ward. Has to be followed. How long you have to follow this contact precautions? Until three negative cultures 1 week apart you get. Okay, you have to continue. Only then you will have to discontinue the contact precautions. For example, today it's Saturday. Okay, today you sent the patient's blood sample for checking if the patient is still infected or today a negative culture report came. The patient does not have the MRSA or VRE strain. It's not that tomorrow you will discharge. 1 more week you will have to wait. The next Saturday, you will again send the blood sample. Okay. It has to come as a negative culture. Then again on the third week, third Saturday, you will send the negative blood sample for culture report. It comes back as negative. So 3 times 1 week apart, 3 times 1 week apart, you get three negative culture report. That's when you can decide. Okay, now finally you can stop the contact precautions like wearing the gloves, hand hygiene, okay, wearing the mask. These precautions can be discontinued only after 3 week apart. You are getting three different negative cultures. That's when you can decide to stop the contact precautions. Until then, the contact precautions have to be followed while dealing with the patient. Other patients with other infections, any form of infection. Okay, it could be a flu, stomach infection, or anything. As soon as you see the symptoms have gone, okay, there is the symptoms have resoluted. Okay, it's time for discontinuing the contact precautions. Okay, but for MRSA and VRE, just because you don't see the symptoms does not mean you can discontinue the contact precaution. Okay. Then coming to tuberculosis, all the respiratory precautions has to be taken, like wearing the mask while treating the patient, giving them treatment, taking the diagnosis, talking to the patient. Okay, even for general patient care procedures, you have to wear the mask while dealing with TB-based patients. Okay, so all the respiratory precautions has to be used. Teach the patients about cough etiquette and all. Okay, always cover their mouth and nose while sneezing, coughing. Separate room is ideal for tuberculosis patients, or a separate ward, a complete ward itself for TB patients. That is ideal. Do not keep the TB patients with any other patients in the hospital. Do not cause that mix up. Elective surgery is preferred for active TB cases. Okay, we wait for the TB infections to completely go down, and then surgery is performed. You can choose the dates based on the DOTS therapy and all. You will know how long the DOTS therapy will go on. Okay, and once the patient is free of infection, then you can go for the elective surgery. But in case of some emergency, when you can't wait for the patient to recover from TB, otherwise the patient may die of another conditions. Okay, for some die because of some complications and not TB. In such kind of situations, we take emergency surgery as well, but with proper respiratory precautions. Okay, especially when it comes to pulmonary TB. Okay, elective surgery is usually postponed for patient who have pulmonary TB or laryngeal TB, because you have to put the anesthesia pipes and all uh, through the trachea. Okay, and if the patient has pulmonary TB, obviously the patient will produce a large amount of mucus. It can cause some blockages in the airway. Okay, so it's risky when it comes to pulmonary TB patients who are going under anesthesia. It is a bit risky surgery. Okay, so we try to postpone it until and unless the patient is no longer infectious. Okay, once the patient is no longer infectious, the patient will not produce any mucus that can block the airway. So it's easier to undertake any elective surgery. Okay. Coming to isolation room, the policies in isolation room, staffs are responsible for taking care of the crowd, traffic control, how many visitors are coming in, going out. Staffs of the isolation room are responsible. They are also responsible in health educating the visitors about the do's and don'ts when it comes to dealing with the infected patients. Health education as well is given by the staffs of the isolation room. Usually, health education is about hand hygiene, respiratory etiquette, mask etiquette for the visitors. Okay, asking them to take some immunization before they visit the patients. Okay, take some prophylaxis before they meet the patients. So, these all things come under the health education. Hand washing, the importance of hand washing, this is also taught in the health education. Okay, hand washing after all contact. When the visitors leave the isolation room, they have to first wash their hands and then get out of the isolation room. So hand washing techniques are also taught to the visitors, okay, of the patient. N95 mask is supplied for the visitors, and no more than 2 adult visitors at a time is allowed to visit the patient in the isolation room. Okay, only 2 adult visitors at a time is allowed. Children below 12 years of age are not allowed in the isolation room. Children who are below 12 years of age are not allowed. Visitors' belongings should be submitted at the reception of the isolation room. Visitors should not take their belongings to the patient, keep it somewhere that belongings will get contaminated. They will get that contaminated belongings out of the isolation room, go to the community, and spread the infection in the community. To prevent that, visitors have to submit their belongings, handbags, and all has to be kept locked in a locker at the reception of the isolation room. Okay, they have to go empty-handed, come back, wash their hands, and then take their belongings and go into the community back. Patient's bed is not allowed for the visitors to use. Visitors should not touch, sit, or use patient's bed. Hand hygiene for the patients is important. Posters of techniques of hand washing step by step should be put on top of the wall wherever there is a hand washing area. Okay, hand washing posters have to be put in picture format so that visitors can just look at the picture and follow the same direction of hand wash. It should be self-explanatory. The posters should be self-explanatory. Then prophylactic medication or any active immunization to protect the visitors or the family. Okay, when we know that somebody in our family is infected with certain disease condition, what prophylaxis can we take to protect ourselves? What medicines? Maybe it could be vitamin C tablets, zinc tablets. Okay, if anyone in your family is suffering from COVID and all, the family members in general have to be put under certain nutritious supplement to protect themselves as well. Okay, so those has to be taken. So this is an example of a isolation ward. You can see here, this is a general access area. Okay, the isolation reception area, everything will be around this general access area. From here, the patient will get, the visitors will go into the change room. They will do their hand washing. They will wear the gowns, aprons, mask, whatever is provided here. Face shields will be provided here. They will wear all this, get into the negative pressure isolation room. Here, the air is completely blown out of the window. Okay, air is pushed out of the room continuously. Okay, that is negative pressure. So here the patient will be, the visitors will meet the patient. Patient's toilet is available here. Staffs and the visitors should not use patient's toilet. Okay, this is only for the use of patient. And once the visitors come out of this room, in the change room, they have to do their hand washing. Okay, discard all the apron, face shield, eye mask, gloves, whatever they were wearing, all the PP they have to dispose, wash their hands properly using hand washing techniques, get out of this changing room, general access area, they can collect their belongings and leave the area. Okay, so this is the general principles followed in a isolation unit. And this is the positive pressure isolation room. You can see here the air is pushed in. In negative pressure, the air is pushed out. But okay, that is where the focus is. Push out the air out of the room. But in positive pressure room, you can see here the good air, the clean, filtered, HEPA filtered, clean, good air is pushed into the room. That is positive pressure. Okay. Here you can see the difference. Negative pressure room, the air flow is just passive. Okay. And air is pushed out of the room. Okay. Here, you can see here in positive pressure rooms, air flow out of the room is very passive. Okay. But air is pushed into the room. That is more aggressively pushed into the room. That's about isolation policy. If you have any queries, you can mention in the chat box.